Ever find yourself staring at a shrinking budget, wondering how you're going to keep your essential programming going? Today in Pack Shapers, we're breaking down the walls between funding silos and discovering how to navigate this complex landscape while staying true to your values. When I was running a crucial public health program, I noticed something that we all experience. We were so focused on delivering programs and meeting grant deliverables that when it came to sustainability planning, we would say, when we have more time, we'll get to it. But let's be honest, there's never extra time in public health. That's when I started considering different approaches. What if we created online self-paced courses for an additional funding stream? This could serve professionals who couldn't attend in-person trainings, while also creating an additional revenue source. By meeting our community where they're at, not where our systems expected them to be, we could expand impact and sustainability. Let's break down the mission-aligned funding framework with 3 key components. First, understanding the full funding spectrum. Most of us start thinking primarily about grants and government funding, but today's reality requires a more diversified approach. Traditional public health funding, government grants, and health department budgets, philanthropic and foundation grants in the middle, and earned income strategies, fee-for-service models, consulting, resources you've developed, or social enterprise ventures. Let's be honest, sustainability planning gets relegated to the last page of a grant proposal and the last month of a funding cycle. But what if sustainability planning was a consistent part of the conversation from day one? Second, the mindset shift from scarcity to strategic alignment. Instead of seeing funding as asking for money, view it as offering partnership opportunities aligned with your mission. Try this perspective shift. You're not seeking charity. You're offering solutions to problems that matter to your partners. The key question changes from who will fund us to whose goals align with our mission and how can we create mutual value. Third, practical strategies for funding diversification. Start with a hidden assets inventory. Every public health program has valuable knowledge, resources, or systems that others might benefit from. Here are 4 specific strategies with real-world examples. Digital learning models, like Khan Academy's freemium approach, where core content is free while premium features create revenue. Tiered service approaches, basic data freely available with advanced analysis tools through a subscription. Community-supported models. Memphis Medical District Collaborative adopted the CSA concept to healthcare with joint investment from institutions and residents. Platform approaches. The ECHO model connects specialists with primary care providers in underserved areas, generating revenue through implementation support. Now, what about our mission and equity? That's why I created the Values First Funding Filter, a tool used to ensure alignment with your core values. Ask yourself, does this funding approach advance or compromise our mission? How does this impact equitable access to our services? Are we being transparent with all of our stakeholders? Now, in the training program I led, if I could do it again, I would add in a pay what you can tier and commit that to every 5 full-priced enrollments. We'd offer a scholarship. We could also create a community dividend, where a certain percentage goes directly back into community initiatives. Let's make this practical. What are 3 things your program does exceptionally well? Who beyond your current audience might value these assets? What problems would your assets help them solve? If you're exploring beyond traditional grants, start small. Begin with a single service that's already well developed. Test it with partners who share your values. Build in feedback mechanisms from day one. Impact Shapers, we're part of a growing movement reimagining funding models. This week, complete the hidden assets inventory and schedule a 30-minute meeting. Sustainability conversation with your team. Ask, if our current funding ended tomorrow, what sustainable paths might we explore? Remember, diversifying your funding doesn't mean compromising your values. It's about creating sustainability so that your values can thrive. By making sustainability an ongoing conversation, you're not only protecting your programs, you're modeling the change we need in public health funding. I'm Veronica, and I'll see you next time.